I did my undergrad, med school, and residency and chief residency here at UC Davis. I'm one of those people. The reason I've stuck around at Sacramento and UC Davis for such a long time now is I've really grown to fall in love with the city as well as the population and program here.
Hello, I'm George Thompson. I'm the Fellowship Program Director for the Infectious Disease Training Program here at UC Davis. I want to just welcome you and thank you for your interest in our training program and give just a bit of kind of a high-level overview of what fellowship here is like. So the UC Davis Medical Center is a very busy medical center, tertiary care, with over 30,000 inpatient admissions per year. We serve over 1 million patients in our outpatient setting and have about 6 million patients in our catchment area. So really a tremendous breadth and diversity of patients you'll encounter while training here. Our infectious disease training program has a long history and really has helped lead the fight against a number of different infections. Our founding chief, Paul Hoprich, wrote the first comprehensive textbook of infectious diseases. Our faculty here in the 80s and 90s were really on the forefront of the early fight against HIV and made tremendous strides. The feline immunodeficiency virus was discovered here. Several other immunodeficiency viruses have been discovered here as well. So our division has really a long history in identifying new outbreaks and new viruses and new pathogens that do cause tremendous problems for our patients.
I'm Stuart Cohen. I'm the division chief, and I've been the division chief for about the last 5 years.
Hi, nice to meet you. My name is Melanie Chakravarthi. I'm one of the faculty members at UC Davis Infectious Diseases Department.
Hi, my name is Alan Koff. I'm one of the infectious disease attendings here. My focus is on transplant infectious diseases and antimicrobial stewardship.
Hi, my name is Urchna Manyar. I am professor of medicine at UC Davis Medical Center in the Division of Infectious Diseases, and I have a joint appointment at the VA where I am hospital epidemiologist and the chief of infection prevention.
I'm Nikki Clayton. I'm one of the infectious disease pharmacists.
My name is Scott Crabtree. I'm one of the assistant professors here in the Division of Infectious Disease.
Hi, my name is Bennett Penn, and I'm one of the faculty here at UC Davis in the Infectious Disease Division.
Hi, my name is Paolo Troia Cancio. I have been with the ID Division since 2000.
Hi, future ID fellows. I'm Hien Nguyen. I'm the Chief of Infectious Diseases at the VA Northern California Healthcare System. I'm also a professor of medicine and vice chief of ID at UC Davis.
We have a diverse faculty with expertise and interest in a number of different pathogens. Several of these are involved with the One Community Health Center, which is an outpatient HIV clinic.
You will be leading a multidisciplinary team at One Community Health that will include nurse practitioners, clinical pharmacists. We also have case managers, behavioral health counselors, psychiatry, optometry. We have an in-house lab that can draw blood for us.
Our faculty there do a number of different clinical trials and have really led the way for some of these new medications that have come out over the last decade. And we partner heavily with the undergraduate campus, which is about 11 miles away. And there they have a Center for Global Health. They have a Center for Vector-Borne Diseases. We have a veterinary school that comes to our case conference, which is really helpful as we talk about zoonotic infections, and also an agriculture center. And a lot of our pathogens really do affect these plants and crops. In this truly one health, one world system we live in now.
I have an interest in global public health, particularly with HIV and TB. I remember the diversity of patient cases were very unique, and what drew me to this program. For example, 1 week on service, we had cases of malaria, TB, and advanced HIV that it almost felt as if I was practicing abroad.
Another aspect about UC Davis is it's located in Sacramento, which is probably one of the most diverse cities I've been in ever. And this is coming from a person who lived in San Jose, LA, and New York. And because of this diversity, you actually get a good, diverse range of pathology and therefore enhanced training.
I never thought that I'd treat so many patients with leprosy and tuberculosis and a million other infections that you don't even know exist right now, but you'll learn soon.
I think one of our biggest strengths at UC Davis is that we have such a diverse population, which then allows for a very diverse set of diseases that we take care of. So you're never going to be missing out on interesting cases. You're definitely going to get a very excellent training here in infectious diseases.
Our fellows treat a tremendous variety of complex medical conditions, and one of our goals during your education and time here is really to expose you to the depth and the breadth of infectious disease. To do this, we really expose you to a number of different settings, so you would rotate at the university hospital, our VA hospital, and a number of different outpatient clinics, one of which is the One Community Health, our outpatient HIV clinic, which I mentioned before. We also have a hepatitis C clinic, a travel medicine clinic, and a number of other different opportunities. We've had some fellows go off-site for global health, rotate in Uganda and Kenya and India, a number of other sites. And then we've recently partnered with the county here, and you can also do a rotation now taking care of tuberculosis patients in conjunction with the county. We have a number of different residents, medical students, nurse practitioner students that round with us, so it's really a fun service to be a part of. You also spend some time on the stewardship service, and that's really of growing importance and I think well recognized now to minimize antibiotic use in the community, really to decrease resistance. And so that you review outpatient and inpatient antibiotic prescriptions. You also have a chance to rotate with infection prevention and infection control, both of which are just of paramount importance as we've seen over the last few years.
Part of our goal at the VA is to integrate our infectious disease fellows into the practice of hospital epidemiology and infection prevention. We've been asking our infectious disease fellows when they are on rotation at the VA to attend our quarterly infection prevention meetings. And I have been working on a curriculum specifically geared towards fellows and infection prevention. Why is this relevant? Well, in this world that we live in, many of you will be practicing infection prevention in the community. And I think it's really important for you to understand the scope and breadth of what the hospital epidemiology practice entails.
I also work with our infection prevention program, which I think is actually a great asset to our hospital because as opposed to many hospitals where I feel like infection prevention and antibiotic stewardship are kind of add-ons and second thoughts, part of the bureaucratic necessities. Here they really actually prioritize it as an asset, and so they support us both with manpower, financing, and just higher up support.
Our hospital has a broad, excellent range of pathology, which provides an excellent environment for career development, regardless of whether you want to be a scientist or a clinician.
The other aspects of things that I've really enjoyed here is just the collegiality between the co-fellows. I know a lot of people will talk about each place feels like family. I really do believe that here at Davis, and it's why I've never left.
Our fellowship graduates have been very successful obtaining their long-term career goals, and our fellows have gone into a number of different areas, private practice in the community. We've had a number go into academics and either stay here at UC Davis or go to other institutions. And we've had fellows go into industry as well and help with pharmaceutical drug development and clinical trials. It is fun. We do get to talk to our graduates pretty frequently. A number, call back just to see how we're doing. We do become friends and colleagues over time, certainly, rather than just maintain a mentor-mentee role. We also put on a CME conference for the community surrounding area of Sacramento every winter, and a lot of our past graduates do come back, and we have a reunion of sorts, which is really a lot of fun. So the academic projects our fellows do, they usually have a lot of fun with, and we give them a tremendous amount of leeway for what they're interested in and what's most consistent with their long-term goals. So these projects can be quality improvement, they can be research, and that can range from both bench to bedsides. We've had fellows rotate in the lab, really work on starting a career for more of a bench scientist type program, and then a lot of our fellows work on more translational type efforts, really to explain why do we see this clinical problem at the bedside? Can we explain this from a pathophysiologic mechanism? Or what's a risk factor? Can we better define this? Can we improve patient outcomes by better understanding their disease and do large database projects?
The ID Fellowship offers you clinical training in a variety of settings, including the VA Northern California healthcare system, which extends from Martinez, California, or Oakland, California, all the way east to the Nevada border in Reno, and all the way north to the Oregon border. In many ways, the VA experience complements your ID training at the university in that it represents what you might see in private practice or practice in a community setting. As a result, there are ample opportunities to apply your learning. On the inpatient side, you'll see a lot of bread and butter infectious diseases. On the outpatient side, There will be opportunities to learn from our OPAP program, as well as specialized training in both hepatitis C management and hepatitis B management.
As for the hospital, everybody has been very friendly. They work really well with us. The transplant teams work really well with us. And I think you get really involved in some of these interesting transplant infectious disease cases. And the teams will call you about the patients. They want to talk about it. They want your input on these cases too, which I think is really special. There's a very active bone marrow transplant program here. So you're going to see a lot of the bread and butter things like neutropenic fever and complications thereof.
Do clinical work in the infectious disease division, seeing patients both inpatient and outpatient here at UC Davis. And I also am a researcher and have a laboratory on Davis main campus where I study M. tuberculosis pathogenesis and the immune response to MTB. The long-term goal of my research is to identify how M. tuberculosis disrupts effective immune responses, with the eventual goal of developing improved vaccine strategies and developing host-directed therapies for tuberculosis patients.
My research program focuses on invasive fungal infections, and that's a number of different diseases. Invasive aspergillosis, invasive candidiasis, and coccidiomycosis are probably the three that work on the most. Partner heavily with a lot of our colleagues on the main campus and their basic science laboratories to really fully grasp and explain the pathophysiologic mechanisms at play, either explain virulence mechanisms, why is there a tropism for these diseases to specific tissue sites. We do a number of translational projects, which are really often multi-center efforts to put large numbers of patients in a big database to really explain fully these syndromes we observe. And then we also have a pretty large and growing clinical trials unit. So we have 8 clinical trials coordinators, and we've been heavily involved in a number of different medications that have come out over the last few years. So isavuconazole, we were heavily involved with that, a number of the C. difficile medications, including a C. difficile vaccine.
Co-fellows become your family, they become your friends. It's just an amazing experience.
There's a real sense of camaraderie and a shared work ethic among the group. And we really think of our ID fellows as colleagues as much as we do as trainees.
Overall, I really love being here, and I'm excited to speak with you all as you come through on interviews.
So I think it's a great place to train. I think you've got a great supportive faculty here too, and we're looking forward to having you guys check it out.
I hope you are staying safe, and I wish you all the best during your interview season, and welcome to UC Davis.
I know this video is really a poor substitute for being able to come out here and meet all of us at UC Davis. But I can assure you we're all very normal, slightly nerdy people who would love the opportunity to take part in your fellowship training.
So that's kind of the end of our overview and summary of the fellowship program. I look forward to getting to know you more and getting to meet you over at least our virtual interview day, and hopefully to see you here as a fellow over the next year. So thanks a lot.